Alberta is promising a major expansion of hospital capacity, including new beds and more surgeries. But opposition voices say the plan is long on announcements and short on action. Here's Mark Villani.
Alberta's government says it's making big moves to boost hospital capacity and cut wait times.
Our acute care action plan is about putting patients and providers first, and that's why we've refocused healthcare.
The province is announcing plans to create more than 1,000 hospital beds over the next 3 years in Edmonton and Calgary. It says mental health and addiction are major drivers of emergency room visits, so it's increasing the number of permanent psychiatric beds, and it's also introducing a neonatal intensive care unit strategy, all while making a commitment to deliver 50,000 additional surgeries.
By expanding hospital operating room capacity and partnering with chartered surgical facilities, ensuring more Albertans receive timely surgeries within clinically recommended wait times.
But some critics say such a plan lacks real action.
There wasn't timelines, there wasn't clear goals. What we really saw today was a so-called action plan as cover for what's really a plan to escalate surgical privatization. 26 facilities across Alberta are experiencing emergency room or obstetric closures. FOIP documents also show paramedics working upwards of 30,000 overtime hours each month this year. Building a few beds in Edmonton and Calgary doesn't solve the staffing crisis that we're in.
Still, the province says restructuring healthcare is the answer. Premier Smith also said she talked to surgical centers who say they have plenty of room.
Their answer was overwhelmingly yes. And so that's why we're adding additional incremental dollars in order to pay based on the surgeries performed.
Alberta's opposition disagrees.
This premier said she would solve healthcare in 90 days. It's been 1,000 days and healthcare has never been worse.
Mark joins us from the South Health campus tonight. So, Mark, the province is aiming to ease the healthcare pressures, but it has also been dealing with a frustrated workforce.
Yeah, that's right, Tara. Finance Minister Nate Horner saying tonight that mediation between Alberta Health Services and the Health Sciences Association of Alberta has now hit a key milestone, with a third-party mediator now recommending terms for a new deal. Now, both sides will take those terms to a ratification vote. This after 60% of the HSAA members have rejected a 4-year 12% wage increase. Now, Horner did thank paramedics, therapists and other frontline staff, but he says there will be no further comment until that ratification vote takes place. Tara.
Okay, Mark, thank you.